Hi, I'm Dr. Datis Kharrazian. I want to talk to you about the gut-thyroid axis, and this is really important for you to understand when you're working with patients that are suffering from Hashimoto's. So first of all, you have to understand that thyroid hormones have a tremendous impact on the gut. Thyroid hormones impact the motor complex in the gut that are involved with motility. This is why one of the most common symptoms of chronic Hashimoto's or hypothyroidism is chronic constipation. Thyroid hormones also directly impact the vagal motor nuclei in the brainstem, which is involved with also controlling intestinal motility and producing the neurological responses to release digestive enzymes. So we know that when patients have hypothyroidism, they really have problems with digesting food, they're not making enzymes, and they also have motility issues. Now, when you add the Hashimoto's component to it, where the autoimmune response is destroying the thyroid, many patients that have Hashimoto's also have this concomitant autoimmunity in the gastrointestinal tract. Some have pernicious anemia, where their immune system is attacking intrinsic factor. Some have target proteins for ulcerative colitis or Crohn's, so they have this intestinal autoimmune disease. Many patients with Hashimoto's have antibodies to what's called transglutaminase 2, which is involved with celiac disease. So there's this another part of this thyroid gut web where there's autoimmune reactivities in the gut. There's lack of thyroid hormones impacting the general functions of the gastrointestinal tract. And then the other things that can also take place is that thyroid hormones are essential for helping the gut and microbiome develop. And the microbiome are these different species of bacteria that are in the gut, but they also play a role in how thyroid hormones are converted from T4 to T3. So at the end of the day, when we look at this interaction between the thyroid gland and Hashimoto's and the connections between these two target areas of the brain and I mean of the gut and of the thyroid, one of the things that we realize is that we have to take a comprehensive approach to manage these. So the model of just like fixing the gut to fix autoimmune disease may not work. And the model of ignoring thyroid hormones may absolutely sabotage any attempts to really fix the gut. So if there's issues like conversion issues or patients are not on replacement, their TSH isn't managed, you will have a really hard time treating the gut. At the same time, if there's an autoimmune reaction response that's happening place in the gut and you don't control the autoimmune responses, then it'll be very hard to untangle patients that are suffering from Hashimoto's. So in our course coming up, Kharrazian Institute, Clinical Strategies and Treatment Applications, I'm going to show you how to clinically work through patients that are suffering from Hashimoto's and their gastrointestinal complaints. Is it primary? Is it secondary? Do you have to treat the autoimmunity first? Do you have to treat the gut first? What's the combination of treatment approaches? How do you evaluate those factors? And those key concepts will make all the difference when it comes to managing these patients that are suffering from Hashimoto's and have chronic gastrointestinal problems and having a really hard time trying to get their autoimmunity under control. So realize that these interconnected loops back and forth and sometimes treating the entire web in a clinical model is the only way that you can really untangle their pathophysiology. So looking forward to your attendance in the course, and thank you for your attention.